Internal conflicts plague the healthcare corporation's board of directors as confidence wanes in the ability of CHC's leadership to turn things around at the hospital.
This past week, I've had the opportunity to speak to at least 15 of the hospital staff, including medical staff. And unfortunately, I would have to say that there was a resounding a voice that there's a total loss of confidence in the administration and quite frankly, loss of confidence in our board.
That's CHC board member Tony Rajo, who represents the hospital's non-physician healthcare professionals. Amid CHC's increasingly dire financial condition, 3 immediate jeopardies involving patient safety recently cited by visiting Medicare inspectors, and growing concerns about the performance of Chief Executive Officer Juan Babalta, Rajo, Tinian board member Anthony Ugun, Rhoda board member Pete Dela Cruz, and then Acting Director of Medical Affairs Daniel Lamar appealed to board chairman Jack Torres to take action.
Members of the board requested Chairman Torres to convene a meeting to address some of these issues, which he adamantly refused to do so.
Including Dr. Lamar, the board would have had the required quorum to call that meeting even without the chairman, but then last week Torres and Babalta declined to recognize the acting DMA's voting power. Lamar subsequently stepped down from his acting DMA post, and the members lost their quorum. In the last year since the formation of the corporation, the CHC board has only met officially about 4 times.
The board should be having regular meetings, and the point of fact is it's a few and far between occurrence when Chairman Torres does call a meeting. And I think that's a growing concern of why that some of the board members had to feel it necessary to call a special meeting.
It's usually the board members who are asking the chair to call a meeting versus the chairman, taking the initiative and doing his job,
Torres declined to comment on the Lamar issue, but asked when he intended to call the next official board meeting. He says this:
As soon as I get proposals to solve problems, proposals for solutions to problems.
What do you mean by that?
Well, we have identified problems, okay? So we need to have proposed solutions to those problems so that we can discuss, debate it at a meeting that I would call, and to determine whether they are appropriate, practical, or otherwise.
But Rajo and Ugun say coming up with solutions and advising CHC management would be the point of regular board meetings. Among their concerns, the continuing lack of a business plan required by the Marianas Public Lands Trust for CHC to obtain a line of credit, and the lack of a strategic plan required by law.
Obviously, in a corporation, this is basic stuff here, You need to have a strategic plan. You need to have a budget. You need to have a business plan. You need to have, all these documents to make a goal for the future, and it doesn't appear that we have those things. And the question is why.
It goes hand in hand. If we're going to get money, we need to have a plan that shows how we're going to use the money and make more money.
Though an actual business plan has yet to be submitted by CHC, Torres says MPLT has received financial spreadsheets. As for the strategic plan, he says the CEO was poised to bid that out when a federally funded hospital assessment by Health Tech was initiated by the Fithiel administration.
And we thought that it'd be probably better if we wait, and because there may not be a need for it, depending on how the assessment comes out, or that would be a foundation for the strategic plan.
But the decision to hold off on the strategic plan was not made at an official board meeting. Ugun and Rajo say that the CHC crisis warrants immediate and aggressive action and a plan forward. Rajo adds that the refusal of the chairman and the CEO to call a meeting to address the numerous issues confronting the hospital goes beyond mere neglect of duty.
It's willful and purposeful malfeasance, and it's undermining the organizational structure of the corporation.